Welcome to the deep dive. Today, we're tackling something I think a lot of us have dealt with, maybe more than we'd like to admit. Frustrating foot and nail issues.
Yeah, things like peeling feet, that really annoying itchiness, and, fungal infections. Athlete's foot, nail fungus.
Exactly. So our goal today is to really dig into why these happen and go beyond just, the surface stuff and figure out what actually helps.
And we've pulled together quite a bit of info for this, looking at medical sites like Medical News Today, Mayo Clinic, Cleveland Clinic, Healthline, WebMD.
Also, the National Eczema Association and even some podiatry specialists like Sol Foot and Ankle and Certified Foot and Ankle Specialists, so a good range.
Definitely.
Because honestly, foot problems can be a real pain. That peeling or wanting to scratch your feet raw when you're trying to sleep, it affects your whole day.
It really can. Sleep disruption is a big one.
So let's start with peeling feet. What are the usual suspects there?
Well, there are actually quite a few reasons why feet might peel. And interestingly, one of the really common ones is athlete's foot, a fungal infection.
Oh, right. You mentioned that. People mistake it for just dry skin sometimes.
Very often, yeah.
Yeah.
Especially early on. You might just see a bit of flakiness, maybe slight itching. Easy to just think, oh, my skin's dry.
Mm-hmm.
But the key can be where it is. Athlete's foot often kicks off between the toes, where it's naturally a bit damper. You might see some redness, maybe even a sort of whitish, soggy look there.
Oh, okay. That's a good clue.
Of course, simple dry skin is also a major cause, especially, in winter or dry climates. And that dryness can lead to cracking, which isn't good.
Creates openings for other problems.
Exactly.
Ah.
Potential infections.
Okay, what about conditions like eczema or psoriasis? We saw those mentioned too.
Yes, definitely. Inflammatory conditions. Eczema covers a few things, like atopic dermatitis, that's kind of classic eczema, or dishydrotic eczema, which gives you those tiny itchy blisters, often on hands and feet. And then psoriasis that's autoimmune. Besides peeling, you often get thickened, sometimes discolored patches of skin.
And corns and calluses? They can peel too.
They're basically just built up dead skin from pressure or friction. Calluses usually on the bottom of the foot, corns more on the toes. And yeah, they can crack and peel.
Okay.
But it's really important not to try and, cut them off yourself. You can easily cause injury or infection.
Good warning. Don't play surgeon at home. What else?
Blisters, obviously, from shoes rubbing, usually. If they break or just as they heal, the skin will peel. And again, popping them is a risk for infection.
Makes sense.
And we should also mention diabetes. Sometimes reduced blood flow linked to diabetes can make the skin on the feet dry and more prone to peeling.
Okay, so lots of potential causes. If someone does have peeling feet, what can they safely try at home?
Moisturizing is key. Using good, thick emollients, things like Aquaphor, Eucerin, that kind of thing, really work it in. If you think it might be mild athlete's foot, you can try an over-the-counter antifungal. Look for ingredients like clotrimazole or tolnaftate.
Right.
For calluses, maybe gently using a pumice stone after soaking your feet, but gently is the word.
Right.
And callus removers, but follow instructions carefully.
And the peeling skin itself, leave it alone.
Pretty much resist that urge to peel it off. It can cause pain, bleeding, infection. If there are loose bits flapping around, carefully trim it with clean scissors. That's much safer.
Got it. Trim, don't tear. Good advice. When should you stop trying home remedies and actually see a doctor?
Definitely if it's causing a lot of discomfort, or if it just isn't getting better after a few weeks of home care.
Okay.
Also, any severe itching, pain, bleeding, or if you see any drainage or open sores that needs checking out. And absolutely, if you have diabetes and you notice foot pain or numbness along with the peeling, or if you suspect it might be psoriasis, because that needs a proper diagnosis and different treatment.
Right. That all seems very clear. Okay, let's pivot to itchy feet. Especially that nighttime itch that can be so maddening. Why does that happen?
Ah, yes, the nighttime itch, or pruritus. It's particularly annoying, isn't it? Dry skin is a big factor again, and we probably notice the itch more when we're still and not distracted.
Makes sense. Less going on, so you focus on the itch.
Exactly. Allergic reactions are another possibility. New soap, lotion, maybe laundry detergent, even the fibers in your socks or sheets. And like we said with peeling, fungal infections, athlete's foot are often very itchy, so sometimes the peeling and itching go hand in hand.
The double whammy, yeah. Anything else trigger that nighttime itch?
Sometimes nerve issues. Peripheral neuropathy, which can be linked to diabetes, can cause itching, tingling, almost like pins and needles, but itchy. And it can feel worse at night.
Interesting.
And though less common, persistent itchy feet can sometimes be a sign of a systemic issue, like liver problems where toxin buildup affects the skin. Other infections too, of course.
Wow, okay. So if your feet are keeping you up scratching, what can you try for some relief at home?
Well, if it seems like dryness, moisturizing before bed with something fragrance-free is a good start.
Okay.
A cool compress can feel really soothing right away. Just wrap some ice or a cool pack in a thin towel.
Nice.
And over-the-counter hydrocortisone cream can help calm down inflammation and itching, too, for short-term use.
Worth a try. Any lifestyle things that might help prevent it?
Yeah, definitely. Choosing breathable socks, cotton, wool, moisture-wicking fabrics.
Right. Let the feet breathe.
Exactly. And good foot hygiene is crucial. Wash your feet daily and dry them really well, especially between the toes. Don't give moisture a chance to hang around.
Good habits.
And, we shouldn't downplay how much persistent itching can affect you. It messes with sleep, scratching can break the skin and lead to infection.
Yeah.
It can genuinely impact your mood and quality of life.
Totally. It's not just a minor thing when it's constant. So when does itching cross the line into needing a doctor?
Basically, if it keeps going despite trying these home care things, if it's persistent, get it checked out to find the real cause.
Okay. Let's dive deeper into the fungal infections now. We keep mentioning athlete's foot tinea pedis. What is it exactly?
Right. So athlete's foot is a fungal infection. It's contagious, and the fungi that cause it just love warm, damp places.
Like sweaty shoes.
Exactly. Or damp locker room floors. That's why it often shows up between the toes. But it can also be on the soles, the tops of the feet, the heels.
And what kind of fungus is it?
It's usually caused by a group called dermatophytes. Think of them as tiny organisms that like to feed on keratin, the protein in our skin, nails, hair. Trichophyton rubrum is a really common one, and you pick it up, walking barefoot in shared spaces like pools, gym showers, locker rooms.
So flip-flops are a must in those places.
Absolutely. Or sharing things like towels, socks, shoes that can spread it too.
Okay, so what are the classic signs someone might have it?
Usually itching is a big one. Stinging or burning sensations too. The skin might look red, cracked, scaly, peeling. Sometimes you get little blisters. And occasionally, there can be a bit of an unpleasant smell associated with
Oh,
it.
right. And there are different types.
Yeah, sources mention a few patterns, like interdigital is between the toes. Moccasin type covers the sole and sides, often looking dry and scaly. Vesicular involves blisters. And ulcerative is rarer, with open sores.
Sounds pretty unpleasant all around. Now, nail fungus on a mycomycosis. Is that related?
Often, yes. Nail fungus specifically infects the toenails, much more often than fingernails. And frequently, it actually starts because athlete's foot spreads from the skin to the nail.
Ah, okay. So one can lead to the other.
Definitely. Though nail fungus can also be caused by other fungi, like certain yeasts, candida, for instance, or some types of molds.
And what does nail fungus look like? How would you know?
It can show up in a few ways, maybe white or yellowish streaks on the nail, or white spots. The nail might get thicker, maybe start lifting away from the nail bed underneath.
Yeah.
It often gets discolored yellow, brown. The nail texture can change, become brittle, crumbly. You might get debris building up into the nail edge, and the nail could even split.
Yeah, not pretty. Are some people more likely to get these fungal infections?
Yes, there are definitely risk factors. Having feet that are wet or damp for long periods, big one.
Right.
Wearing shoes that don't breathe well, especially synthetic materials, traps moisture and heat. Using those communal facilities barefoot, like we said. Also, certain health conditions increase risk: diabetes, poor circulation, anything that weakens the immune system, and even some sports where feet get really sweaty and stay in shoes for ages.
Makes sense. So keeping feet dry and aired out is super important. How does a doctor diagnose these, for sure?
Usually starts with just looking closely at the skin or nails, a physical exam. But to be certain it's fungal, they'll often take a small scraping of the skin or a clipping of the nail.
And send it to a lab.
Exactly. They can look at it under a microscope or try to grow the fungus in a culture to identify exactly what it is.
Okay. And treatments. What works?
For athlete's foot, you usually start with topical antifungals. Creams, sprays, powders you can get over the counter.
Right.
If those don't cut it, a doctor might prescribe something stronger, either topical or sometimes oral pills that fight the fungus from the inside.
Okay. How long does treatment usually take?
For athlete's foot with topicals, you typically need to be consistent for about 4 weeks, sometimes longer, even if it looks better sooner. And some people use antifungal powders like tolnaftate ongoing to help prevent it coming back.
And nail fungus, is that harder to treat?
It generally is, yeah, mostly because nails grow so slowly.
Hmm.
Options include special antifungal nail lacquers you paint on, prescription topical creams.
Mm-hmm.
Sometimes things like laser therapy or ultrasound are used. In really tough cases, they might even need to remove the affected nail. That's called nail avulsion.
Wow.
Oral antifungal pills are often more effective for nail fungus and work faster than topicals, but they can have side effects and need monitoring, so that's a discussion with your doctor.
Right. So prevention sounds like the way to go if possible. What are the top tips?
For athlete's foot,
Yeah.
wear sandals in communal wet areas, showers, pools. Dry your feet really well after washing, especially between the toes.
Okay.
Choose natural fiber socks like cotton or wool. Change them if they get damp. Try to alternate your shoes so they can fully dry out between wears. And don't share towels, socks, or shoes.
Good basics. And for preventing nail fungus.
Biggest thing is treat athlete's foot promptly so it doesn't spread to the nails. Keep your nail clippers clean, maybe sanitize them. Keep toenails trimmed short and straight across. And moisturize your feet dry. Cracked skin is an entry point for fungus.
Some sources even say toss old shoes you wore during an infection.
Yeah, that's sometimes recommended, just to reduce the chance of reinfecting yourself from spores lingering in the shoes.
Makes sense. And you mentioned finishing the whole course of treatment is vital.
Absolutely critical, especially with athlete's foot. Even if it looks and feels better, the fungus might still be hanging around. Stopping treatment early means it can come right back, and you also risk creating antifungal resistance.
Good point. And athlete's foot can spread elsewhere.
Oh yeah, if you scratch your itchy feet and then touch other areas, you can potentially spread it to your hands, or commonly the groin area jock itch is often caused by the same type of fungus, and of course to the nails.
Okay, wow, that covers fungal infections really well. Now, sometimes things can look similar. How do you tell psoriasis on the feet apart from athlete's foot?
That's a really important question because the treatments are totally different. Psoriasis, remember, is autoimmune, not contagious. It causes skin cells to grow too fast, creating those thick red patches, often with silvery white scales plaques.
Right.
And while it can be on the feet, especially the soles, psoriasis often appears elsewhere too. Elbows, knees, scalp, or common spots. You might also see nail changes like pitting and sometimes joint pain, psoriatic arthritis.
Okay, so look for those silvery scales and potentially other affected areas. How does athlete's foot look different?
Athlete's foot is contagious, caused by fungus. It's almost always just on the feet, loving those moist areas like between the toes. The rash might be red and scaly, yes, but often looks more macerated, kind of white, soggy, peeling.
Ah, that soggy look.
Yeah, and it's usually intensely itchy, maybe burning. You might see cracking or those small blisters we mentioned.
So, key differences. Contagiousness, where else it shows up on the body, and does it respond to antifungal cream?
Exactly. Athlete's foot should improve with over-the-counter antifungals. Psoriasis won't. And if there's real doubt, a skin scraping test by a doctor can confirm if fungus is present.
Okay. What about other lookalikes? Sometimes seborrheic dermatitis gets mentioned. How's that different from psoriasis?
They can look a bit similar, true. Both cause red, scaly patches. But psoriasis usually has those thicker, silvery scales with really defined edges. Plaques can be painful.
And seborrheic dermatitis.
The patches there tend to look greasier, maybe more yellowish or whitish yellow, sometimes red or brown. And the scales are often thinner, flakier.
Greasy is a key word there.
Yeah, because it often hits oily areas, scalp, like bad dandruff, folds by the nose, eyebrows, ears, sometimes the chest or back. Not typically feet.
And it's not autoimmune like psoriasis.
No, it's not autoimmune, might be linked to yeast on the skin, hormones, oil production.
Yeah.
It's not contagious either. And interestingly, you can actually have both conditions at once. They call it sebop psoriasis.
Wow, complex. So how would you tell seborrheic dermatitis from athlete's foot? Sounds like location is the main clue.
Absolutely. Location is huge there.
Mm.
Seborrheic dermatitis hits those oily zones, scalp, face, chest, groin, almost never palms or soles.
Right.
Athlete's foot is specifically on the feet between toes, soles, maybe tops or heels. And it's that itchy, sometimes burning, peeling, cracking rash caused by a contagious fungus. Seborrheic dermatitis isn't contagious and looks different, more greasy, flaky scales.
Okay, location for that one. This has been incredibly thorough. So wrapping things up, what are the absolute main takeaways for our listeners?
I think the big things are peeling and itching feet can have many causes. Don't just assume it's one thing. Fungal infections like athlete's foot are really common and contagious, so prevention matters. And other conditions like psoriasis or eczema can definitely show up on the feet too. Getting the right diagnosis is key for the right treatment.
So paying attention to the details is important.
Exactly. Notice the symptoms, where they are, what makes them better or worse. Those clues are really helpful.
And just to reiterate, when should you definitely seek professional help?
If things aren't getting better with home care, if they're getting worse, if you see signs of infection like pus, increased redness, warmth, bad pain, or if you have an underlying condition like diabetes, don't wait on those.
Excellent points. Well, thank you so much. This was incredibly informative, a real deep dive into keeping our feet happy. I learned a lot.
My pleasure. And yeah, it's worth remembering to pay attention to your feet. They carry us everywhere. Understanding their signals helps keep us healthy and comfortable.
Absolutely.
Makes you wonder, doesn't it? For anyone listening who's dealt with these, what was that key thing, that observation or piece of advice that finally helped you figure it out and get some relief, something to think about?